At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Centers.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. So I'd like to start off each and every week. I'd like to say hello to all our loyal listeners. Thank you for listening each and every week, and a special hello to anyone who's new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB 6:20 a.m. from 9 to 10 in the morning. And if you are new to the show, typically in the first half hour or so of the show, we typically talk about the very wide variety, very unique and wide variety of treatment options we offer, all under one roof, right here at the American Back Centers. As I always give you a brief history, Dr. Dennis Miskovich started this practice almost 50 years ago. It's going to be 50 years here soon. He started this practice, been in the local Wexford area here. Used to be in the building. It's now an Ace Hardware building. Now we're right down the street across from formerly Atria's, now Ditka's restaurants. I've seen that company that owns Atria's also owns Ditka's. They've been changing a lot of the Atria's over to Ditka's, which is nice. It's a nice restaurant, of course. Local guy from Aliquippa, right? Football player, and also played at Pitt. So nice restaurant, and we're right across the street from that, right here in the heart of Wexford Cranberry at 103 Bradford Road, right here in the Stonewood Commons office complex, Building 2, Suite 100. And more importantly, in the last 20 years, we've been known as Pittsburgh area's disc specialty center, helping thousands, I'm not exaggerating that, thousands of patients over those last 20 years with these difficult disc-related issues. Some of these patients have been to every doctor known to man. They've been to pain clinics for epidurals, pain shots, physical therapy, in some cases even to other chiropractic doctors for chiropractic adjustments, which has helped them for many years, but in some cases they've hit a wall where the disc condition now has reached its limitations possibly with the adjustments, and now they have a more severe condition, which is where VAX-D comes in many cases. VAX-D is specifically for these more severe disc issues, bulges, herniations, extrusions, cases that are not responding to your conventional treatment. Chiropractic physical therapy. Physical therapy does a great job of strengthening the surrounding muscles, but does not directly address the disc. In some cases, the therapist will try to do traction. A lot of doctors will try these so-called decompression disc treatments that you hear out there advertised. And if you really look and do your own research, as I always tell you, do your research. You will see with VAX-D. VAX-D's been around for 20 years and will be around for another 20 years because they continue to upgrade their technology. They get better and better, and VAX-D is the best and the only FDA-approved procedure for these type of problems, and it's used by all specialties, medical doctors, orthopedic surgeons, in private practice. There's a few hospitals, chiropractic physicians, and physical therapists all use and accept VAX-D, and only VAX-D. That should tell you something about these other so-called disc treatments you hear out there advertised on TV and radio. Why are not all specialties using and accepting it? And, of course, VAX-D has the research. In the latest and newest technology, again, the only non-invasive treatment through research, peer-reviewed research, Drs. Ramos and Martin, two neurosurgeons way back in 1994, later published in the Journal of Neurosurgery in 1994, showing for the first time and still to date the only non-invasive, non-surgical medical device that has been proven to create negative pressure, reduce the interdiscal pressure, the pressure within your disc, the cause of the problem, the compression, opening up that structural compression, opening up and allowing fluid and nutrients to come back into that desiccated, degenerated, dying disc, allowing the fluid and nutrients, oxygen, as I mentioned, but more importantly, pulling that disc material that's herniated, bulged, extruded off the nerve, relieving your sciatica, out of the spinal canal, relieving your spinal stenosis. These debilitating, disabling conditions that we see each and every day. leg pain, hip pain, buttocks pain, in many cases is radiating from the lower back and the disc. Numbness and tingling, weakness, foot drop, all common presentations we see here. But again, the only way we know if you don't have an MRI or at least an X-ray, if you have these type of problems, is by you coming in and scheduling a consultation. We sit down with you, answer all your questions. We've been doing this a long time, so we definitely know what we're doing here with these disc issues as well as any musculoskeletal issue, but we specialize as Pittsburgh area's disc specialty center for over 20 years now. So that's what we do here. That's what we talk about in the first half hour, some of the unique and wide variety treatment options we offer here for almost 50 years now, and for the last 20 years, specializing in these difficult disc-related cases. In the second half hour of the show, we typically talk about a nutrition or fitness-related topic. The last few weeks, we had some very interesting topics. Last week, we touched on why arthritic patients shouldn't rely on drugs. Of course, we always stress the natural, dietary, as well as natural remedies, which we have some great products here. The Boswellia Complex has Boswellia, ginger, and turmeric all in one formula. Of course, we have the high-dose fish oils, some of them backed by research by Dr. Maroon, and showing that according to his research, that this high dose, I call it juiced up fish oil, per se, is comparable to Celebrex, Bextra, and Vioxx, of course, without any side effects because it's a natural fish oil. So we offer that here at our office for pain relief, as well as the Boswellia Complex, again with Boswellia, ginger, and turmeric, as well as other strong, very natural anti-inflammatories. We also have a nice handout that we give to our patients on an anti-inflammatory diet, as well as the foods to avoid, the pro-inflammatory foods as well. So we touch on that with each and every patient as well, and we touched on that last week as well. And the issues with opiates and painkillers and how they are so damaging to the body and how they're becoming addictive. And you see that with Tiger Woods, 4 failed back surgeries, now he's addicted to opiates. It is a huge, huge problem in today's society, opiate addiction, and you definitely want to avoid that, especially if you yourself or you know someone who's suffering with severe back pain, even neck pain. And you don't want to get caught up with these opiates and these prescription pain pills, and in many cases can cause more harm than good. We also touched on how to safeguard your bone health naturally, talked about 1 in 3 women, 1 in 5 men over the age of 50 will experience an osteoporotic-related bone fracture. 20% of those will break a hip in the first 12 months following the fracture. Talked about some weight-bearing exercises, some dietary issues. We have some great natural products, incorporating the vitamin D, the vitamin K2, and the calcium together with magnesium, the 4 key supplements you want together in a bone-building supplement, which we offer here at the American Back Centers, as well as the importance of the K2, not allowing that calcium to go into the arteries. We touch on that over and over and over. We have a couple different products, the Ultra K2D3 in a chewable form that has that K2 with the D3, and then you can take whatever calcium you want with that and magnesium. We have a product that has all 4 in one. And then we also have the L-arginine Complete, which gives you that nitric oxide production with the L-arginine and L-citrulline, which we touched on, helps to dilate the blood vessels, opens up, lowers blood pressure, increases circulation, great for neuropathy, circulation issues, but also, more importantly, has the vitamin D3 and the K2 in this product in a powdered form, very highly absorbed, because you're not having to take a pill and having to worry about that dissolving and absorbing in the body. And a couple weeks ago, we touched on the number of people suffering from osteoarthritis as well. So all of this, and we touched on some of the natural issues with that. We have a great hyaluronic acid, glucosamine, chondroitin sulfate product, which helps to rebuild cartilage. We also have the esterified fatty acid complex, too. A lot of patients are not responding to glucosamine, hyaluronic acid, so we do have the alternative. There's a lot of research showing that people that don't respond to glucosamine may respond to the esterified fatty acid complex, so we also have that as well. Always looking for ways. We tell people when they're approaching bone-on-bone in the hip, the knees, whatever joint it may be, and they're told they may need surgery soon or replacement. Always try to do everything you can to try to rebuild. And in some cases, when you're not even near that point, it's helpful to prevent. After the age of 40, it may be helpful for many patients to prevent these type of problems, especially if they have a family history of hip arthritis, knee issues as well. Prevention is the key, and we touched on prevention. We have some great products we just mentioned: DHA, glucosamine, chondroitin, and the esterified fatty acids. If you'd like to try these products, call our office. We can send them to you. You can pick them up and save the shipping fee. Today we're going to be touching on avoiding and treating headaches naturally, very, very common problem in today's society. We're going to touch on some of the dietary issues, nutritional, as well as, of course, chiropractic, of course, which can help with misaligned bones and irritation of nerves, which can definitely trigger headaches as a possible cause, as well as other issues you may not be aware of or may not think of that may be triggering or causing your headaches. So definitely stay tuned for that in the second half hour of the show today. Also, anything we talk about, and we try to do it each and every week. We may miss a week, but for the most part, most weeks we put the radio show information, the nutrition fitness information, on the Facebook page. Our Facebook page is American Back Centers Pittsburgh. So if you have Facebook, if you don't even have a Facebook page, you can still go on there and check out our page. If you can take a second to like our page, we would greatly appreciate that. And you can download, print out any of the articles we touch on right on the Facebook page. So it's quick and easy. If you have a computer, you have the internet, just go on and do that. We ask only if you don't have a computer or the internet, we can send these articles out to you free of charge, only if you don't have access to that. Because otherwise we'll be sending out hundreds of pamphlets and mailings to patients. So we do ask to keep our postal fees down, only if you don't have a computer, but we're more than happy to send out anything to anyone if you don't have access to that. Again, visit our Facebook page, or you can go on Mercola.com and get this information, avoiding and treating headaches. So again, our Facebook page is American Back Centers Pittsburgh. And again, if you can take a second to like our page when you're on there as well, you can friend us as well and get our information each and every week sent to your Facebook page, of course, at no charge. Okay, of course, as always, at the American Back Centers, we are not your typical chiropractic office. As I mentioned, since 1994, the American Back Centers has specialized in the treatment of very difficult cases, including herniated disc, bulging disc, failed back and neck surgery, sciatica, stenosis, and degenerative disc disease. So the VAX-D is specifically for the lower back and the mid-back region, but we do have disc treatment options, very similar to the VAX-D, for the neck region. Excuse me. So if you have a bulging or herniated disc in the neck region, we definitely can help you with that as well. So we do have state-of-the-art procedures. Yes, the VAX-D, and a lot of people ask me, well, the VAX-D is 20 years old. But no, VAX-D has continued to upgrade their equipment. And they have the latest technology, and we talk about the logarithmic curve and how VAX-D has the research, and still to date the only device that has been proven that actually does do what it says it does, per se. It has the research showing that real-life subjects continue to get the treatment. They put pressure sensors, and it's showing each and every time you undergo VAX-D, negative pressure is produced, reduction in interdiscal pressure, and you're actually getting and proving that you're getting that vacuum that's allowing the flow of fluid and nutrients back in the disc, pulling that disc material back into place. With other so-called disc treatments, and I do apologize for my voice today. I have a little bit of allergies today with the ragweed, and I do apologize for that, clearing my throat. But so bear with me today. I do apologize. But with the VAX-D, it's one of a kind, and there's so many people out there claiming disc treatments that they do things similar to VAX-D. We touch on that each and every week. How in many cases they actually use VAX-D's research, and we also remind you that that research was done back in 1994, well before these procedures are even thought of. So there's many glorified traction disc treatments out there that make a lot of claims, but if you do your own research, you will see that VAX-D is one of a kind. And that's why, again, common sense would tell you why are all specialties using this procedure. Why do you not see that with these other disc treatments? You may see 3 facilities across the country. You may see a few here or there. But with VAC-STI, there's 300 facilities, hospitals, medical, chiropractic, physical therapists, all using it. 3,000 patients a day. Nothing comes close to that. And that's why VAC-STI's been around for a long time, will continue to be around for a long time, helping thousands of patients with these difficult disc-related conditions. Some of the greatest athletes in the NBA, NFL, NHL, Olympic athletes have used VAC-STI. We had a professional actor here a few years ago, Forrest Whitaker, Greg Lloyd. Many professional people see this procedure as the best, safest alternative to back surgery. So again, as I ask you each and every week, if you're out there listening, you yourself or you know someone who's suffering from back or neck pain, unresponsive to your current treatment, you want to avoid surgery, pain medication, you want to avoid a second, third, or fourth failed back surgery. You can't believe how many people come in here each and every day, multiple failed back surgeries. They don't know where to turn. They've gone to, even in some cases, some to our competitors that have these so-called disc treatments. They want thousands of dollars for these really unproven treatments which they claim to have science and research behind them. In many cases, they don't even tell you what the procedure is, so that should put up a red flag right there, what the procedure is, and they're trying to hide things from you. With VAC-STI, there's nothing to hide. VAC-STI's been around for many years. They continue to upgrade their equipment and technology. We continue to get better and better as our protocols change each and every year with VAC-STI, and our success rate continues to get higher and higher with VAC-STI therapy and our unique protocols we offer here at American Back Centers. So if you're suffering from these type of problems, and you've been through that gauntlet, which I always call it the gauntlet, I just make up a name and I call it the gauntlet, and patients start with pain medication, self-medication at home, prescription, they go to their PCP, they put them on a steroid pack, possibly giving them some relief, but it's symptomatic, it's a Band-Aid. Then they send them for physical therapy. The physical therapy may or may not help them, but it's not truly addressing the structural compression causing the disc problem, if they indeed have a disc problem. In some cases, they don't even know they have a disc problem. They think they just have a back issue, a simple back issue at that point. And that's how these things begin in many cases. They think they have a simple back issue. They don't think much of it. And slowly but surely, the compression is occurring in the back because no one's done an MRI or even an X-ray. In some cases, they may not even look for a compressed disc on the X-ray. Excuse me, on the X-ray. And that's a very telltale sign when you start to see the space, in some cases, in many cases with a disc issue, the space between the vertebrae start to diminish on an X-ray. That's a telltale sign that the compression is beginning to occur, and that can happen many, many months, if not years, prior to the actual diagnosis of a disc problem, where the patient starts to have pain down the leg, numbness and tingling, in some cases weakness, before they even do the MRI and diagnose you with a disc problem. Then they'll send you to a pain clinic. You'll get pain shots. They're hoping that those pain shots, which we all know, are no better in many cases, and the research supports this, no better than placebo injections. Just buying yourself some time, but the problem with buying yourself some time is the compression is still occurring. We show patients this on diagrams and models in our office that the compression is still occurring, and now you've gone to the next stage of degeneration, arthritis, compression, and now it becomes even more difficult to deal with. And then they send you to a surgeon. Surgeon tells you either you're not a candidate for surgery, come back and see me later, go do some more physical therapy, some more pain shots, or let's do surgery. So you go back and do the physical therapy, you do more pain shots, then you go back. When that doesn't help, because it's not addressing the structural cause of the problem in many cases, not all cases, sometimes physical therapy alone can strengthen the muscles enough that your condition can stabilize. And you can buy yourself more years, more time before the condition comes back again. Or the condition resolves. There are a few cases where the disc condition resolves itself, but that's few and far between. Then they go for surgery, and they get the surgery. They snip off a piece of the disc or the bone. We talk about that's not addressing the structural compression problem. And then they eventually want to do a fusion to the back. If that doesn't work, rods and screws, fixing the segment, taking care of the compression, but now the areas above and below have to compensate, and we see the problems there where the patient has to go in for another surgery and get more fusions. And we see the fusion surgery very much a money-making procedure for the hospitals and the clinics, but no greater success. And we see this over and over. National Institutes of Health, 9 out of 10 back surgeries not successful. British Medical Journal, American Medical Association, state lumbar disc surgery, ineffective, not successful. Saying no to back surgery, that article which I've stretched on this show many, many times. New York Times, latest Journal of American Medical Association has another example of the downsides of too much medical care. Back surgeries, which bring more complications and no better results. Over and over and over, we stress this, and hopefully you out there listening to this radio show will tell your friends, your neighbors, relatives that there is a safe, effective alternative to back surgery that doesn't cost thousands of dollars, and we compare that to laser spinal surgery, which they claim to be less invasive. We touch on this many shows on this show. They have to rip out ligament, bone, and tissue before that laser even goes in. And the laser, to most surgeons, is no different. They're still just snipping off a piece of the disc after causing that permanent damage. And that's not including the $20,000 to $40,000 out-of-pocket expense that you see with these procedures. There's even some competitors out there of VAX-D that have these so-called disc treatments, even here in the Pittsburgh area, claiming to be the same or even better than VAX-D, claiming to have artificially high success rates. But when you go to see them, they don't want to tell you what the procedure is. They hide a lot of things, and you have to wonder, what is the procedure? Because we know it's not VAX-D, and VAX-D is the only FDA-approved, safe, clinically proven treatment out there for disc problems. And you're paying upwards of $7,000, $8,000 for these treatment protocols at these facilities, and you're getting no better results. In some cases, no results whatsoever, and then the patients end up at our office. We have patients all the time coming to us from these so-called disc treatments that you hear out there advertised, spending close to $10,000 on these procedures, and now they're no better. In some cases, actually worse and in more pain. So VAX-D, again, is the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there that has the proof in the pudding, as I say. Has the research showing with real live sensors and real live patients that pressure is reduced each and every time you undergo the therapy. Upwards of a negative 200 millimeters of mercury produced each and every time you receive VAX-D therapy, allowing the flow of nutrients, oxygen, back into that compressed, degenerated disc, pulling the disc material off the nerve out of the canal, relieving your spinal stenosis, sciatica, arthritis, not allowing those bone spurs to continue to occur and grow and eventually fuse by opening up that disc space. Also very effective with failed back surgery conditions and people with multiple failed back surgeries. We help people all the time with failed back surgery. The only way we know we can help you is by you coming in and scheduling a free consultation. So we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Over 300 facilities worldwide instituting VAX-D, 3,000 patients a day. Don't wait until your condition worsens. Call us today. Our toll-free number is 1-888-222-8293, 1-888-222-8293. We are the VAX-D Center in this area, so you don't have to travel far. We have people calling from out of state on a routine basis. We will try to refer them to a facility in their area. If somebody's calling, we just had somebody call in from California the other day. Of course, there's VAX-D facilities out in California as well. We will try to help you find a local location. Of course, if you want to come see us, you definitely can. We have the experience. We're one of the most experienced facilities in the country instituting this type of care. So our toll-free number, again, is 1-888-222-8293 or 724-935-3300 to schedule your free consultation. Also, our fax number, we do encourage you to fax over reports. You can fax over an X-ray, MRI report. That's a typewritten report that comes with when the radiologist interprets your X-ray, CT, or MRI. You can have that faxed over from the facility. Just remember where you had it done at, and then call them, give them our fax number, and they can fax that over to us either prior to scheduling your consultation or once your consultation is scheduled, you can have it here and ready for when you come in. So we have that, so you don't have to pick it up. In some cases, it's not included in with the disc or the films, so we can make sure we have that. Our fax number is 724-935-3321. 724-935-3321 is our fax number. If you're coming from a great distance, we have a lot of people coming from all over the country, let alone the tri-state area. If you want to just fax over your report and have us look at it prior to you driving all the way out here, we do have a list of hotels on our website as well. If you need an overnight lodging, our website is www.americanbackcenters.com. Again, AmericanBackCenters.com is a link to our website, and you can actually request an appointment on the website and learn more about our office. There's some great information discussing VaxD, the services, our blog and patient education section. You can go on there and subscribe to our daily health update newsletter. You automatically get signed up for the monthly In Good Hands newsletter as well. The monthly In Good Hands newsletter has a wealth of information from some of the greatest health minds in the country. Contribute to that once a month, so you get that free when you sign up for the daily health update newsletter. This newsletter sends your email daily with health tips and a inspirational quote for the day, so it's a great way to start off the day. And if you don't have time to look at it, you can just go to the next email or delete it if you so choose, and you'll get a new one the next day with great health tips. Updated health tips each and every day and an inspirational quote free of charge by signing up at www.americanbackcenters.com. And again, checking out our website and requesting an appointment on there as well. You can do that today. In addition to the VaxD, we also offer cervical disc treatments. If you have a disc problem in the neck region, as I mentioned, bulging, herniation, degeneration in the neck region of a disc, or even you're contemplating neck surgery, or you've had failed neck surgery, give us a call. We may be able to help you. We've helped hundreds, if not thousands, of patients with disc problems in the neck region. Therapy and rehab. We do therapy for the neck, the back, the shoulder, the knee, the ankle, any musculoskeletal issue. We have structured programs for our disc patients, specific programs for our disc patients, one-of-a-kind therapy and rehab that we offer as part of our VaxD program. Wrist, hand, finger, foot, ankle, knee problems, we adjust and treat those areas, tendonitis, rotator cuff, carpal tunnel. We do therapy and rehab. Patients coming in with following surgery on their hips, their knees, we can do the therapy right here at our office. We can do therapy to help prevent those issues as well. We have the nutrition, we have the therapy, we have the chiropractic, we have the specialized disc treatments. We also have a great licensed massage therapist with over 25 years of experience instituting deep tissue massage, myofascial trigger point therapy, acupressure, as well as reflexology. Comprehensive nutritional consultations, if you so choose, giving you a very comprehensive idea of what your nutritional needs may be. Custom-made orthotics, we touch on this each and every week. Really, really great items that are truly custom to your individual problem. People don't really understand that it starts from the ground up in many cases, and they have back issues. In some cases, we take care of 90% of it, and then we look down, and we're wondering why, in some cases, they still have a little bit of pain, maybe even putting stress on their knees and hips, causing premature degeneration. Then we look at the feet, and then we address the feet with a custom-made orthotic, and that makes all the difference in many cases, taking that pressure off that knee, taking that wear and tear off that knee, that hip. In some cases, the hip pain, the knee pain, could be coming from that area because of the wear and tear, but you always need to look at the areas above and below as a good doctor. And in many cases, we see problems in the arches, contributing to hammer toes, bunions, fallen arches, that are causing problems in the knees, in the hips, the back, in some cases all the way up into the neck region as well, which is a common issue as well. People having neck pain, and it sounds far-fetched from their feet, but we see it each and every day. So we have the custom-made. So we're not going in the back and getting you an orthotic off the shelf, even though some people claim custom-made, and they do that. This is electronically scanned, so there's no error with doctor or patient putting a foot into a casting kit. If you so choose, we can still do that We have the old casting kits, but the digital 3D scanner is so much more accurate. There's less error, and you're getting a truly custom scan of your foot. This is electronically sent to the company, and within 5 to 7 business days, a custom-made orthotic is made and fitted to your shoe. Acupressure treatment, we have great success with sinus issues. A lot of people with the changes in weather, changes in seasons, are having sinus-related issues. Patients remark how much they are draining. I work on their sinuses with the acupressure points, and their sinuses immediately drain. They get instant relief. In-house X-ray nerve conduction testing, if you need that. Ultrasound testing done right here at the American Back Centers. And we have a convenient MRI facility right across the street. If you need an MRI or CT, they also have walk-in X-rays. In some cases, we do the X-rays in the office, but certain areas I don't X-ray, so I will just send you right across the street, and they have walk-in. You don't even have to make an appointment for the X-ray. So we have all that right here in our location, or right across the street, North Pittsburgh Imaging, if you need those specialized imaging. Literally just go right across the street. So it's very, very convenient for our office and for our patients. So if you'd like to schedule a free consultation at no cost or obligation, of course, call our office, again, toll-free, 1-888-222-8293 or 724-935-3300. Remember, if you want to fax over the reports, 724-935-3321 is the fax number. And also, you can check out our website, www.americanbackcenters.com. You can request an appointment, check out all the ins and outs of VaxD and why VaxD is the best treatment option for these type of problems, a natural, safe alternative to back surgery. We've helped many people with failed back surgery as well. There's some great blog and patient education section. Of course, sign up for our daily health update newsletter as well. You can also receive the free DVD. With the DVD, you also get a 24-page Keller booklet describing the ins and outs of VaxD therapy. It's a great way for you to understand how VaxD works. And the video is when Channel 11, WPXI, heard about all the success that we have helping people avoid back surgery and these issues with sciatica, stenosis, and disc problems. And they brought the TV cameras out and did a medical breakthroughs report and put us on Channel 11 News. And we were very excited about this, and we put this on a DVD so you can see it. Dr. Miskovich answers some key questions about VaxD therapy, and there's some great patient testimonials on there as well on some of the patients we've helped. On this free DVD, you also get the free 24-page Keller booklet. We also have the blue workers' comp book and the yellow auto accident booklet. Great resources. So many people each and every day are taken advantage of by workers' comp. The insurance company, the employers, they're told a lot of falsehoods. A lot of people out there right now may be listening to the show or hurt at work, or you know someone that's hurt at work, and they were told, well, they can't file a complaint, they can't file a work injury, they can't do this and that. I've heard crazy stories where they told a patient that since they weren't lifting an object, they were pushing or pulling an object at work, and I think I've touched on this the last couple of weeks, they couldn't file a workers' comp complaint, and that's simply untrue. You hear a lot of craziness out there of what the employer in some cases, and there's a lot of good employers, and there's a lot of good insurance companies out there as well, but there's a lot of other ones that try to look out for their best interests, not necessarily the patient's or the worker's best interests, and that's very unfortunate when we see that, because now we have an issue where they're just looking to save money, namely the insurance companies in many cases, trying to save money, and that's very, very unfortunate. And they're just looking, insurance industry, you will see, is trying to make money. It is a business, and they're trying not to lose money. In many cases, they will do anything they can to get the patient back to work, or the worker, I should say, or the patient back to work as soon as possible, even in some cases before they're well. So we can help you out with that. If you're in that situation, you can get this blue workers' comp book. It's done by an attorney out in the Philadelphia region, so he's never going to be calling you and soliciting your business, so you don't have to worry about that. But it's a great way to make sure you're not being taken advantage of. So if you know someone in that situation, call and get this booklet for them. Ask for the blue workers' comp book or the yellow auto accident booklet. Again, same thing goes with auto accidents. A lot of people don't know their rights. Personal injury cases as well. Great way to just kind of dot all your I's, cross all your T's, per se, and making sure that you're doing things right. In many cases, attorneys are happy that you've read this book before you even need an attorney, so you don't make these common mistakes that people make. So ask for the blue workers' comp book and the yellow auto accident book. They're both free, and they're a great resource from our office. And we do see a lot of workers' comp patients here. If you've been hurt at work, you've been diagnosed with a lumbar sprain strain, you think you may have more, you're not getting well with the panel doctors, call us. We may be able to help you with our specialized disc treatments here at the American Back Centers. If you've been hurt in a car accident, you have whiplash, you may have a neck issue with pain extending down the arms, back issue, pain extending down the legs, you may have a disc problem. The only way we're going to know that is by coming in, examining you, possibly ordering a X-ray or MRI, and then diagnosing that. So if you have those type of problems, call us today. We specialize in this. We've helped many people with auto cases, whiplash, as well as workers' comp injuries as well. So give us a call today, again, toll-free, 1-888-222-8293. We also have those research papers. We're very proud of the research paper published in the Canadian Journal of Clinical Medicine. It was done right here at the American Back Center. It was on BackTalk. We can send that out to you. And the Knife in the Back article, again, showing the failures of back surgery and why back surgery is not the best approach for these type of chronic back pain issues, and how it's such a money-making procedure for hospitals and medical clinics who are looking for ways to make money. Now the insurance companies are really putting a clamp down on doctors and hospitals, looking for ways to make money. And what better way to do it with a $60,000 to $70,000 procedure, if not more in some cases, which is what you get with the pre- and post-op and all the things that go into lumbar fusion surgeries. And all the invasiveness. We talk about the rods and screws and all the possible infection, bleeding, blood clots that can occur with these types of conditions. Again, the real question should be, why would you even think about surgery with all its complications and lack of success, not including the normal risks that you hear about with every surgery, infection, bleeding, and blood clots that can actually kill you? When VAXI is an option, remember, VAXI is a non-invasive treatment with a safe, much, much higher success rate than surgery, pain injections, or physical therapy. Many patients go this route and eventually end up at our office wishing they would have come to us much sooner. Remember, VAXI addresses the structural cause, not just the symptoms, truly restoring the fluid content to that compressed, starved disc, taking the compression off the spine and the disc, relieving your pain associated with low back pain, disc problems, herniated, degenerated, extruded, bulge, foot drop, sciatica, stenosis, numbness and tingling, and even failed back surgery cases. So if you're looking for a non-surgical solution to low back pain, sciatica, stenosis, that's where VAXT comes in. Again, trust the original patented VAXT procedure. It's been around for over 20 years. Many doctors choose VAXT over these other so-called disc devices because it employs the original patented technology from which non-surgical spinal decompression therapy was born. VAXT, again, makes a commitment to back pain sufferers to offer an honest product backed by clinical research. VAXT gives you real science with real results. That's a very important note. Again, VAXT has been around for many years. They continue to upgrade their technology. And will be around for another 20 years, as I mentioned, because it works. And it's accepted, again, by all specialties. There's medical doctors, orthopedic surgeons in private practice. There's a few hospitals that have VAXT, chiropractic physicians, and physical therapists. The question I have is, why do these so-called disc treatments not have the same rap sheet? As far as that goes, as far as the patients, 3,000 patients a day, 300 facilities worldwide doing VAXT therapy, and the best professional athletes, NBA, NFL, NHL, Olympic athletes, all over the country using and seeing VAXT as the best treatment option out there. Best alternative to back. And in the case of neck surgery, we also have the neck treatments out there here at our office that can help you with neck issues. If you have a bulging herniated disc in the neck region, we may be able to help you as well. So again, call us today, toll-free 1-888-222-8293 or 724-935-3300. All right, before we get into the nutrition segment today, I'd like to highlight some of our nutritional supplements from time to time. Of course, the Intramax. Touch on this almost each and every week. Intramax is the best all-in-one liquid multivitamin in the market. I take it myself. It's the best adult multivitamin. We also have the Intra-Kid for the kids, the under 18 parent, or the child, I should say, supplement to the Intramax. And the Intramax is an all-in-one liquid, 100% organic liquid multivitamin with over 415 essential ingredients in one bottle. The list just goes on and on, 100% natural, 100% vegetarian, no additives, no preservatives, no cholesterol, wheat, glutens, caffeine, corn, yeast, nothing artificial, no artificial colors, additives, products, flavors, nothing, no fillers, nothing whatsoever in this product but a natural, organic, liquid multivitamin. So I highly recommend it, number one, because it's a liquid and it's highly absorbed, so you're not worrying about the pill dissolving or not dissolving. You're not having to take a big horse pill. It's not synthetic. It's 100% natural, and you're getting what you're paying for. And it's a great all-in-one product with just about the most that I could see in a multivitamin ever fit into one product. Again, over 415 different in one bottle of this product. So we do offer free shipping or discount for trying the Intramax or the Intra-Kid. If you'd like to try that today, call our office. Also, some other products we have as well is the cannabis, the hemp cream, and the hemp oil. The hemp cream, we have level 1 through level 5. The level 5 we have found comparable to many prescription pain pills, of course, without any side effects. We've had patients that they can attest to that. They are legal in all 50 states. They are FDA-approved clinical ingredients, and they are powerful pain killers. If you're looking for long-lasting, fast pain relief from muscle and joint pain, arthritis, sprains, bruises, cramps, and related discomfort, you may want to try the hemp cream. We also have the hemp oil. People are seeing amazing results with autism tendencies, as well as the product web. So the little girl's name is Charlotte. She actually had epilepsy, and she had seizures. And through taking the product, the hemp oil, the sublingual hemp oil product, which is now named Charlotte's Web in honor of her name, she had reduced her seizures to almost none whatsoever. So they're seeing amazing results with epilepsy, with seizures, as well as tremors and Parkinson's disease as well. So the hemp oil, the sublingual, we also offer that, Charlotte's Web, and the hemp cream for pain and arthritis, if you'd like to try that, in the levels 1 through level 5. Give us a call. We can send them out to you for a small shipping fee. The level 5s do go very quickly, so call us today if you'd like to try that and reserve some, because we can order some for you, because they do, as soon as they come in the door, they pretty much go out because they are so effective, and of course they're natural and there's no side effects with them. So call us today if you'd like to try the cream, hemp cream, or the hemp oil. Also, we touched on last week, and we'll touch a little bit more on this next week, we have an exciting new doctor-supervised weight loss program. And it's a fast, long-term weight loss program. It's designed and supervised by doctors. You're looking at losing 20 to 35 pounds in 6 weeks. The exciting part is there's no exercise, no drugs, no prepackaged foods, shakes or bars. There are 2 supplements that go with the program. The one supplement has 3 of the key thermogenic, safe weight loss ingredients, including the raspberry ketones, Garcinia cambogia, green coffee bean extract, and B vitamins, stimulating metabolism. And then we also have Drop, a supplement which comes in a dropper that is an appetite suppressant and completely natural. There's nothing synthetic in these products. And they're extremely effective, and patients are seeing losses of upwards of 20 to 35 pounds in only 6 weeks. And 2 of my office workers have already started it, and within a week or a week and a half, one of them has lost 9 pounds and the other one has lost 8 pounds. So they're definitely on goal, because typically after 3 weeks you're looking to lose 10 pounds, and after 6 weeks you're looking to lose 20 to 30 pounds. So they're definitely on pace to do that after only a week and a half, almost losing 10 pounds, which is the 3-week goal. So it is a very safe, long-term weight loss solution, and we're excited to offer this in our office. Right now, we're offering a severe discount, as we're just introducing it to the public and listening audience, severe discount on the program. And if you can get on it right now, you can get the discount, because we will be raising the price here probably in the next 1 to 2 months as the program really takes off. And we're seeing amazing, again, results with this. We're seeing it with our workers and staff, as well as with our patients as well. So if you'd like to try, call our office. It's completely safe. Again, no exercise, no drugs, no prepackaged foods, shakes, or bars. It's completely doctor designed and doctor supervised. And again, patients are seeing a loss of 20 to 35 pounds in 6 weeks. And that's how this product works. And we'll touch more about this in the next few weeks on BackTalk, how the program works. But again, completely natural supplements. And the dietary program, again, is doctor supervised, and it works. So if you'd like to try it, give us a call and get in on the ground floor of the discounted program until before we raise the price and go to the recommended suggested price for the program, which is what the company is suggesting. But we're, again, lowering the price as we introduce this to the listening audience and the public for a brief period of time. And then from there, we're going to go to the normal price probably in the next 1 to 2 months. All right, so, of course, again, if you'd like to schedule a consultation, visit our website, www.americanbackcenters.com. You can request an appointment right on the website, or you can call our office, 724-935-3300, or 1-888-222-8293 to schedule a consultation. For the Chirothin, any of the treatment options we offer all under one roof right here at the American Back Centers. Again, for almost 50 years now, we've been in business, helping people in the last 20 years, specializing as Pittsburgh area's disc specialty center. So if you think that you may be a candidate for VaxD, give us a call. You can schedule that consultation. You can get that literature, the free DVD. Channel 11 did our medical breakthroughs report on our office, a 24-page Keller booklet, or the research papers we mentioned, and even more importantly, that blue workers' comp or the yellow auto accident booklet, both great resources as an injured worker or someone injured in an auto accident. All right, today we're going to start on the avoiding and treating headaches. We may not get through all of it because I went a little bit long there today, and I do apologize. This is from Macola.com. And so many people suffer from headaches. Nearly half of the world's population suffers from headaches each year, making it the most common disorder of the nervous system. Only about half of those affected seek medical attention. Even though they may take a heavy toll on your ability to work, socialize, and be productive each day. In the UK, for instance, an estimated 25 million work or school days are lost each year due to migraine headaches alone. Even in the United States, most of those suffering from migraines are dependent on over-the-counter medications for relief. There are other options, though. Not the only treatment, but also for helping to avoid headaches in the first place. Let's go over a couple types of headaches first. What are the most common types of headaches? Tension headaches are the most common primary headache disorder, affecting almost up to 70% of some populations. Estimated 3% of adults suffer from chronic tension headaches, which often begin in the teenage years and affect women more often than men. Tension headaches are often the result of stress or musculoskeletal problems such as poor posture and cause pressure that may feel like a tight band around your head. Most cases resolve on their own in a few hours, but for chronic cases, the pain can be disabling. Other type of headaches include migraine, which are triggered in your brain, cause release of pain-producing inflammatory substances around the nerves and blood vessels in your head. Number 3, cluster headaches, which describes a brief but extremely severe headache that occur frequently and with pain typically around one eye. So some drug-free approaches, well, actually before we get to that, there's a 4th type of headache, medication overuse headache, which is caused, ironically, by chronic use of headache medication. So some of the drug-free approaches to relieving headache pain, number 1 is exercise. A quick workout may be able to stop your headache from progressing, possibly because it triggers the release of pain-reducing neurotransmitters. Choose a low-impact activity like riding a stationary bike, using an elliptical machine, walking on a treadmill, to avoid further stress to the pounding head. Regular workouts are recommended to help reduce the frequency and intensity of headaches and migraines. The body releases endorphins, the body's natural painkillers. Exercise also reduces stress and helps individuals to sleep at night. Stress and inadequate sleep are two migraine triggers. Number 2, massage. We have a great licensed massage therapist with over 25 years of experience, and he'll tell you that definitely trigger points in muscular tension can trigger headaches. Gently massaging your temples, neck, scalp may help relieve tension headaches. Core-type traditional massage, which includes 5 massage points on your face and head, have been found to relieve chronic tension headaches as well. As I mentioned earlier on the show, I do a great acupressure treatment for the sinuses. A lot of patients notice immediate sinus drainage and relief of their sinus pain and pressure when we work on these points here at the office. Herbal remedies. Feverfew, ginger, may help to relieve migraine pain according to research published in the Journal of Headache. You can try steeping chopped fresh ginger in water to make a tea, or even chewing directly on a piece of peeled ginger for a natural headache, quote, medicine, according to America's pharmacist Susie Cohen. She also recommends rhodola for headaches as well. The Russian herb rhodola is helpful for someone with a tension headache because it increases levels of serotonin, which makes you feel good. As we skip on down, chamomile tea is another option, especially for the relief of tension headaches. Look for pure chamomile tea bags or make your own by steeping dry chamomile flower in hot water. And, of course, filter before you drink. You can also find fresh betel leaves, B-E-T-E-L, and you can try grinding them into a fine paste, applying them to your forehead and sides of the head. Let it sit for 30 minutes before rinsing off. Betel leaves have anti-inflammatory, pain-relieving, and stimulation properties, among others. As we skip on down, some other issues to be aware of. Essential oils are biologically active compounds of flowers and plants in highly concentrated form. Indirect inhalation of essential oils using a diffuser or placing the drops nearby can be helpful for headaches. Aromatherapy massage with the essential oils diluted in a carrier oil and massage in your skin may be helpful as well. Number 5, a cup of black coffee. And, of course, organic coffee, so you're not getting the pesticides. In a pinch, a cup of coffee will give you a quick dose of caffeine that may help constrict the blood vessels leading to your head, helping to relieve the pain. An ice pack held on the forehead or temples may also accomplish this as well. Some migraine patients also report that a strong cup of coffee helps to stop an attack. But in some cases, caffeine can also trigger an attack, so listen to your body. Several headache medications, including Excedrin, include caffeine as an active ingredient. The use of caffeine for pain relief is best reserved for only occasional headache pain, because it can actually make your headache worse and can also give you the headache withdrawal headaches as well that you can get from time to time. 10 foods that may trigger migraine. This is important as well. Alcohol, especially red wine with the sulfates, non-organic red wine, can definitely trigger a migraine headache. Caffeinated beverages, as mentioned. This is a double-edged sword, sometimes helping, sometimes hurting the headache pain, making things worse, making you caffeine dependent in some cases. Aged cheeses. Cheddar, amongst other aged cheeses, can trigger migraines. Cured processed meats like hot dogs, sausages, and lunch meats. The preservatives, MSG. Aspartame, the artificial sweetener. Citrus fruits. Legumes, beans, peas, and lentils. This is a less common trigger, but can be reported to trigger migraines. Nuts. Chocolate, another potential trigger, but this is still being substantiated as chocolate being a trigger of migraines. So, as we go on with the article, if you suffer from migraines, he goes on to state, in order to successfully treat the underlying cause, you need to regenerate the cell batteries. The cell mitochondria is one way to do this by taking coenzyme Q10. So there is research showing that CoQ10 is a great way to help prevent migraines as well. I take CoQ10 with my fish oil. I have a great fish oil product here at the office that has a high level of EPA DHA, so you're getting your fish oil and the CoQ10 in one tablet. and we offer that right here at the American Back Centers. So you're getting that together, so you're actually saving money. So you're getting the CoQ10, which is good for your heart, but also they're seeing research may help prevent migraine headaches as well. Also, some other things to consider with recurrent headaches is a deficiency in magnesium. Spirulina is another good source that helps and has been shown to relieve migraine headaches because it's high in bioavailable magnesium. Also, consumption of green leafy vegetables are very high in magnesium as well. So magnesium deficiency may be a trigger for migraine headaches as well. Also, the topic of asthma and allergies causing your headaches. Both migraines and asthma are caused by inflammation of the blood vessels for migraines and of the airways for asthma. So those who have migraines and asthma are at double the risk of developing chronic migraines, according to new research. Asthma is associated with increased risk of new-onset chronic migraine 1 year later among individuals with episodic migraines, the highest risk being among those with the greatest number of respiratory symptoms. So there is a connection between asthma and migraines, and this could be allergies. Allergies are more common in people with asthma and people with headaches. Researchers suggested that treating allergies more aggressively may help. If you have asthma or allergies, optimizing your vitamin D levels is absolutely critical because vitamin D deficiency may be a primary cause of asthma. Vitamin D deficiency may also play a role in migraine headaches. So you may want to try upping your vitamin D levels as well. Also, other vitamin deficiencies include vitamin B2, riboflavin, B6, B12, and folic acid. Some other 7 tips to avoid headaches as well. Maintaining your sleep schedule. Staying on a regular sleep schedule is very important. Eat according to your regular meal schedule. Avoid skipping meals. Avoid hangover headaches. If you're drinking a lot of red wine or alcohol, it can definitely trigger a headache. One of the biggest causes of headaches is dehydration, which definitely hangovers and alcohol can do. Watch what you eat. We just touched on some of the things that you should be not eating. Avoid fragrant triggers. Be aware of bright lights, which can definitely trigger migraines in many patients. And set aside some me time, some relaxation time to relax to definitely reduce the incidence of tension headaches. All right, we're short on time, so we'll definitely summarize that article next week, so definitely stay tuned for that. We're going to touch more on the Chirothin program as well, the new weight loss program that we offer here at the office. But I'm going to leave you with some final closing thoughts. Again, why would you even consider surgery when VAC-C is available? Please be smart. Remember, surgery is a permanent procedure with possible permanent complications such as infection, bleeding, blood clots, scar tissue, and advanced degeneration. And again, remember, surgery doesn't really address the structural cause of the problem like VAC-C does. A smart, educated person who regularly listens to this radio station and show knows this and will usually make the right choice for their health. I want to thank everyone for listening today. We'll be on next Wednesday and every Wednesday with another episode of BackTalk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to BackTalk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for BackTalk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.